Many women ask me, are they going to lose any strength to their chest muscles after surgery? And so the answer to this is sometimes no and sometimes yes. Now, implants placed in front of the muscle do not move when you activate your pec muscles. So basically you can't make your breast move up and down with muscle activation. Also, implants placed on top of the muscle do not affect your pec muscle function. In contrast, when implants are placed under the muscle, the breasts typically move every time you contract your pec muscles. This results in the breast implant separating, and therefore the cleavage becomes quite wide while the muscle contracts. This occurs for all under the muscle implant placements. In addition to this, muscle contraction often causes a dynamic double bubble effect, which refers to a significant indentation occurring to the underboob every time you contract your muscle. This occurs because the pec muscle remains attached to the breast tissue at this level, and it pulls on it every time you contract. Now, an implant inserted with a modified undermuscle technique such as a dual plane type 2 technique can minimize or prevent this dynamic double bubble from happening. However, this type of dual plane technique results in a loss of muscle function due to the complete detachment of the muscle from the chest wall and the breast tissue at the lower end, and the subsequent retraction and wasting away of this segment of muscle. In contrast, the common undermuscle technique, otherwise known as a dual plane type 1, does not result in any real muscle function loss. In this situation, whilst the pec muscle is typically detached from the chest wall along the lower sternum and the breast region, it still remains attached to the breast tissue, so the muscle can't retract and waste away. It does of course result in a potential dynamic double bubble effect.